Thanks so much for inviting us here tonight. It's such a pleasure to be here. I think it's important to note that the definition of palliative care has been really evolving over the last 20 years. And there might be a lot of questions or misperceptions about what palliative care is and perhaps what it is not. So palliative care and the medical subspecialty of palliative medicine is specialized medical care for patients who are facing serious illnesses and for their families. It focuses on relieving the symptoms of an illness, but also the stresses that come along with that illness. It focuses on quality of life, so that idea of living well with illness. So again, the title of our night tonight. We also like to think about it as an extra layer of support to the care that's being provided by your primary team. If you could just remember that term, extra layer support, whatever that support means to you, whether it's symptom control, addressing emotional or psychological or spiritual pain, that's what palliative care is all about.
And I think the big question was palliative care versus hospice.
So the question of hospice versus palliative care, I wonder if it just would be good just to take a moment just to unpack that a little bit. So I think of it as a continuum. So palliative care, again, is this supportive care that's integrated throughout the course of a serious illness. Hospice care is provided at the very end of life. So by Medicare definition, it's in the last 6 months of life. So the last months to year of life. And it's a package of services that can be provided at someone's home, in a nursing home, or a freestanding facility. So those are the places where hospice care is provided by an interdisciplinary team, so a team of many different disciplines to provide end-of-life care, where palliative care is more the continuous care throughout the course of a serious illness.
The issue of how does palliative care get engaged?
Yes, Corey?
How do you figure out who will be the team leader, the person who you go to initiate and keep track of everything?
Yeah, so the question is, who is the team leader? So again, part of it is whoever the patient feels most close to when you meet with the team. It often defaults to the physician, but that's not always the case. So sometimes it's the social worker, sometimes it's the chaplain.
I am diabetic, and I am not adjusted to be a diabetic yet. I hate to recognize that I am, but it is, and we are going to find the best way.